We really are delighted to have you here, and Mike certainly does look for questions and discussion, so I would encourage you to take advantage of a very unique opportunity.
Right. Thanks, Barry. Yes, please, as I'm going through this, I'm going to be going through some stuff kind of quickly and then get to the meat of the stuff in the middle. So healthcare and government budgets. This is the overview of what I'm going to talk about. Why do governments care about healthcare? What is health and healthcare? Insights into healthcare spending, Medicare, Medicaid, U.S. Some of this is from the slides and the presentation material from last class, and Barry already stole my thunder talking about why governments care about healthcare. And then a little bit more of the meat of the matter about why governments, private sector payers care about value. Was in a meeting from 8 a.m. to 4 p.m. today about value. It's the third time in less than 2 weeks that I've been in a meeting all day about value, so it's not a trivial matter. And then how healthcare and healthcare spending connect to each other, and then a little bit about the ACA. I guess I can, there we go. So this is a projected outlays for the major budget programs of the federal government. Major health programs is number one. This is percent of GDP, 2016. You can see it's just the biggest single chunk of the federal government's budget, no matter how you look at it. Here, this is 2015, the outlays, its share of the federal budget. Medicare is 15%, Medicaid's another 9%, so you put that together. 24%, it's the same as Social Security, and then you get all these other things. It's just such a big piece of the pie. It's federal budget, state budget. It's about a quarter of every state budget. Very state to state. That's something we can get into, is how different the different states are in all sorts of facets, their budgets, their governments, their structures, their legislators. And looking within each state, Medicaid, about a third of the Medicaid spending from the state comes from their general revenues, and then about 58% come from federal funds, and then the states come up with some other money to pay for Medicaid. That's what goes into this 25, 26%. And it varies between 20 and 30% generally in most states. So why do governments care about it? About health spending? Well, spending, deficits, debt, solvency, the Willie Sutton principle. It's where the money is. I mean, and again, I want to point this out. In this course, you've got classes about different subjects about federal budgeting and fiscal policy. This is the only class on one specific topic. There's no transportation class. There's no energy and environment class. There's no trade class. Healthcare is such a big chunk for federal and state spending. They also care about it because they want a productive workforce, economic prosperity, and even a capable military. The military is worried about obesity because they can't find enough recruits that meet their minimum physical standards for enrollment. Just to give you a broad overview, and this was in the other slides, updated a little bit. Source of funds, this is total U.S. health spending. The blue is, the colored ones are the government programs. Medicare is 22%, federal and state Medicaid, and then a little bit in VA, DOD, and state public health. Where does that money go? Right? This is where the money comes from. Who pays it? This is also a time of shock for a lot of people. Hospitals are about a third. Physicians and other clinical services in the outpatient are about a third. Prescription drugs, retail prescription drugs, this has become an interesting issue recently, are about 10%. There's about another 4 or 5% of prescription drugs spread out between hospitals and doctors, where people don't give the injections themselves. They get given to them in the hospital or the doctor's office. So that's just background. What is health? I mean, why do we care about healthcare spending if not for health? Wrong button. So thinking about it, and this is a complete flip around from the way I'd done this class in the past. Barry said it was okay. We'll let him know afterwards how it went. We're going to be thinking about health. If what means a person's healthy? Anybody? Bueller?
Defined by the individual.
Defined by the individual. Well, there's different categories of health too, right? In our culture, at least, there's physical health, oral health, mental health, and then possibly public health. The World Health Organization, they go globally, basically say health is a state of complete physical, mental, and social well-being, not merely absence of disease or infirmity. Basically what that means is health is not defined by you're not sick. And then, what's your name?
Dennis.
Dennis, I can't quite see. What do people think? What do communities, governments think? And what do you think? If you're a policymaker or a policy analyst trying to decide on programs, Medicare versus Medicaid or other things we'll get into, how do you prioritize some of these things? It's exactly up to the individual or the policymaker, policy official, or policy advisor. What is healthcare? Same thing. How do you define what healthcare is? Some of that's up to the individual a little bit. But the IOM, the Institute of Medicine, it's actually now called the National Academy of Medicine. They changed their name. But it's basically what services give you good health. I'm paraphrasing that. Again, how do populations, people, communities, governments, and others, what do they value in terms of healthcare? And there's, in like the Medicare program, there's oftentimes a debate about what qualifies as healthcare and what doesn't. What qualifies in other countries is different than here sometimes. And again, what do you think as a policymaker, policy advisor, policy,
Does that drive why different states have different senses of health spending? Because they have different definitions of health care? Or is there something else?
A little bit in terms of not what they define as health care, but what they might cover, what they might, say we will pay for. So one Medicaid program versus another in terms of benefits. And Medicare and legislation and policy constantly are going through that. I know when I was working in Congress and other places, some of the non-physician clinician, should those services be covered, particularly like acupuncturists, chiropractors, naturopaths, other sorts of things. Is that healthcare? Is it not? And we'll talk a little more about that towards the end. So people talk about the U.S. healthcare system, right? What is the U.S. healthcare system? A lot of times people mean the financing system, Medicare, Medicaid, blah, 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 or they mean the delivery system. But there's also research, public health, and they all kind of interact together. Obviously, these circles are not meant to be reflective of the size of budgets or anything. It's a schematic. We're going to talk mostly about finance and then get back into delivery towards the end.